Hey, what's up, you guys, and welcome to another episode of We Need to Talk, the Quarantine Chronicles. I'm your host, Malynda, and we are joined finally by my co-host, Karmel, who's calling in. Who are you calling in? Where are you calling in from, Karmel?
I'm calling in from Downey, California.
I was gonna say Downey, but I wasn't sure. Is that where your mom lives? You're visiting her? Okay, that's what I thought. But where do you hold up residence?
Orange County, Anaheim.
I thought so. They're getting a little crazy
Must
out
be
there.
nice.
And of course, we're joined by my husband, but y'all know that he was here because he's
it's
quarantined.
Quarantine Chronicles.
It's a Quarantine Chronicles. How have you been dealing with your stay-at-home order, Karmel? So we didn't get to talk to you last week.
What stay-at-home order?
Oh, you're one of those, are you?
No, I've been fine. I mean, I've been here. I mean, that's probably the reason why I'm staying with my mom, just because, like, you know, I don't have family where I'm staying at, and so, like, if I want to pick somewhere to kind of be held up for a while, I decided I'll just chill with my mom and be around people that I know and love and help her out and everything. So it's been all right. It's been
That's
cool.
good. You know, I actually know a lot of people, like, when it started to feel like it was going towards this, that we're going to be quarantined. I know a couple of people that, like, flew home to be with their family. They're like, if I'm going to be stuck somewhere, I don't want to be alone in my apartment in Los Angeles. So I think it's nice. And obviously it's nice to be here with John and our baby girl. She's strapped to my chest right now. Because the best piece of advice that I got was from Karmel, is to be loud when they're napping so that they can
Speak on it. I'm telling y'all.
That's funny.
Any of y'all having kids out there, don't be babying them. I know they're a baby. Don't do it.
And tiptoeing. Well, the other day, though, I was kind of tiptoeing around her. And then today I was like, when we were texting, I was like, wait, Karmel was like, no, be loud. And I was like, yeah, we should be, because otherwise...
You gotta crawl to the fridge to eat.
Yeah.
Don't crawl, don't eat.
But seriously, it's tempting to want to be quiet when you have a kid and they're napping, but otherwise that's the only thing that you can do if that's what they're used to. So thank you for that advice. I really appreciate it. All right, let's get into a little bit of what's going on lately with COVID-19. Have you been watching the press conferences? Every time I turn them on, John leaves the room because he can't hear Trump speak. Like, he literally leaves the room.
You know what? I don't blame him. It's hard for me to listen to any of them, honestly. It's too much at this point. I've seen too many. I've heard too many. And, like, some of these press conferences, they know we're growing tired of hearing them talk, so they just put someone up random. The other day it was a LA City press conference. They had a librarian up there.
Well, that's kind of cool.
Changing
what
it
did
up
she
a little.
say?
Yeah.
Or
but what the hell does she know about infectious diseases?
Was she talking about them?
She could have been reading about them.
Wait, this is interesting to me. What did she say?
Honestly, as soon as I read the title, she walked through the thing and it said Director of Librarian Services. I'm like, I'm out. I didn't even listen. I didn't care. Why is a librarian? What does she need to say? I think, to be honest with you, I kind of heard from afar. She was just saying things like things you can do under quarantine, how the library is still available, you know, online and stuff like that. I'm like, okay, that's cool, but like...
The library is available online? It's barely available in person.
Well, a lot of people use a library don't have ready access to the internet.
That's true. That's true. Okay, that's
so we should have called in and questioned her about that.
For real.
But one of the interesting things that I've been seeing in the last couple weeks that it came to no surprise to me was just that COVID-19 was hitting like a disproportionate amount of African Americans, and it was affecting them and killing them. And I want to talk a little bit about that because I think people don't realize the bigger issue with this, that it actually comes down to the healthcare system and what is available to minorities.
Yes. I mean, I look at it two ways. That the main thing is, yes, it's not just COVID-19, but it's healthcare, period. Mm-hmm. Like, we're just not serviced. Like, and this is, again, we talked about this in many other podcasts before this, that where we are now in society, in our country, is not where people think we need to be. Like, again, this has just been 50, 60 years we've been out of Jim Crow, but this is a direct result of that. The things that happened to us just 50, 60 years ago is why we're so disproportionately underserviced in so many other pieces of societal issues. We just don't get the same service, whether education or health or finances, banking, all that stuff. We don't have those things available. Right. So this issue has brought that up. I don't necessarily look at it as that COVID-19 is the issue. It's something larger than that, but that's just what we're using right now as a terminology.
Why do you think that people... Well, John, I'll ask you this, just as watching it happen. Why do you think that people are only now realizing this because of this pandemic rather than paying attention to it before?
I mean, I think this is a wake-up call to for a lot of reasons. There are people who might be like obese that, yeah, I'll get on track or something, but then you see that, oh, this can actually bite you, right? If you have one of those like comorbidities, if there's something else that's underlying that you've been skating by and it's been okay, right? But you haven't had your hand be forced. You're starting to see this, and it's like, well, actually, if you had been healthy, you would have had a much better chance at taking this thing on. So it's just bringing that stuff to light, I guess.
Well, it's interesting that you talk about if you had been healthy thing, because as we do know, African Americans suffer more. They suffer from obesity, they suffer from heart disease. But then you also have to look at the systemic racism aspect of that. The fact that like a lot of African American communities, they don't even have like grocery stores where they can get fresh vegetables and fruit. So it's quick. I feel like it's easy for people to be like, oh, well, African Americans aren't healthy. They eat this, they eat that. But you have to look at what's available to them.
Yeah.
Right.
Go ahead.
I think that's the biggest thing I've gotten out of this, and I've talked to some people about, is that this is an immunodeficiency issue. People, it doesn't, whether it's coronavirus, whether it's any other disease that's out there, even going back to the HIV epidemic, one of the reasons why Black people are so adversely affected by that, because we just naturally have deficiencies with our immune system because of what we don't have readily available that other people do. So I think, as John mentioned, if you were obese, if you're a smoker or whatever, and they're like, oh shoot, I got to stop smoking, not because of coronavirus, because you need to just stop smoking.
Right. Right.
So it's like, those are the things I think people are being made aware of, and that's kind of why I'm been so passionate about people not just focusing on COVID, but focusing on their health. To me, that's the biggest issue.
Do you think that there's a skepticism about healthcare among minorities more so than
1,000%?
Because I know, like, especially older generations, like, they just don't want to see a doctor.
They don't trust him. Yeah. They don't trust him. Yeah.
No, we have a long history of being not just underserviced, but literally done wrong.
Like mistreated, right?
Things have been done to us, whether here or abroad, that are just atrocities, and it's been propagated by our own health system. So it's like it's not something we're making up. This has been done before.
Absolutely. Absolutely. Even for me, it was always important to have a Black female doctor for myself, especially when we decided we were going to have kids and going to give birth, because of looking at the Black female mortality rate when it comes to childbirth. And I had long conversations with my doctor, like flat out, I do not want to die in this hospital because of everything that I've read. So it really isn't just paranoia. It isn't us making it up. There really is just flat out racism in the healthcare system that has caused a lot of minorities' death. And it's scary. It really, really is. I get the skepticism, but I also have to say, I think you can be skeptical, but still be cautious,
100%. 100%. That's why I've always stressed, like, what makes the most logical sense.
Right.
And when it comes to disease and beating diseases, it's always been immunity. It's always been build your immune system to naturally fight off diseases. Since the dawn of time. A disease pops up, we build immunity. Now, people die all the time because they don't have the immune system built up to fight it. And that's kind of just, natural selection to not be, so cold or morbid.
Right.
But that's just what happens.
Right.
But we naturally are in communal situations, playing in the dirt, being on animals, we build immunity, and that allows us to get a little sick, and then we fight it off. When I was a kid, I got chickenpox. And then I remember once you get chickenpox, you're immune from it. I didn't understand that as a kid, but now I understand as an adult, my immune system is not built to fight that off. So I think that's what I'm always trying to stress to people. I can give you conspiracy theories. I can give you a bunch of like propaganda. Who cares? Build your immunity system, your immunity, and you don't have to worry about that stuff.
Right. And that's that's what happens with the flu. So I'm curious if that's what's going to happen with this. There's kind of speculation that it has already happened, and we've talked a little bit about
with like a herd immunity.
Yeah.
Yeah, I don't know. We're still just finding out all about this. I know that so Germany right now is of the Western world is on the forefront of this, which planning to essentially test the entire country over the next year repeatedly for antibodies to see how much this is spread. There's also a study done out of Stanford for the Bay Area when initial estimates maybe that close to 50 to 85 times higher, the spread that what they were initially anticipating, because this thing is can spread while folks are asymptomatic and don't realize they even had it. So yeah, that's the question with this stuff. And we see, I mean, honestly, the way that this is probably going to go is a game of essentially whack-a-mole with this virus through various waves, where a little bit more people get infected each successive wave until there is a vaccine. And because the thing is, we have no immunity. The world doesn't have an immunity right now, but you can either build up a natural immunity, right, or you can inoculate folks by just giving their immune systems the code to break that down and to fight it. So I think that's probably going to end up being the case, which will be, I don't know, 2021.
Oh, I mean, it's not going to be this year. That's for sure.
Right.
Yeah.
Hopefully.
Yeah. See, that's kind of been the funny thing to me. That's kind of like weird. Like, I guess there was one lady they were talking about. She had coronavirus, whatever, beat it, and they were doing a study on her to get her antibodies, to study them and possibly create a vaccine using her antibodies. So I'm thinking, wait a minute, we're going to take someone's antibodies out of them and then make something to inject into me. Why not just build my own? Like, I could have my own antibodies. Like, why? I don't understand, like, how we can trust science
honestly,
over nature,
Yeah. So, I mean, the thing is, we see that this virus is just affecting people different ways. So it's just running the risk of, like, look, you'll have, I don't know, for whatever reason, let's just say that you are in an at-risk group for something you either know you have or something that you're not sure you have, where your chances of survival are, I don't know, 80%, right? Versus, 0% by getting, a shot with some code built into it, essentially. That's how you, throw people into things, how you get them to learn. They can either, I don't know. I mean, it's the baby metaphor thing. Like, could our child, forage her way to survive by sheer instinct alone? I mean, maybe.
Yeah.
If you set things close to her and you just kind of leave her there, like, it's probably, like, her chances of survival aren't zero.
Right.
Or you could just, bottle feed her until she, can do it herself. That's just how that stuff goes. But I mean, honestly, this is just it's straight up science. I don't. We'll see how stuff goes. I'm actually more interested in seeing, because when I mentioned, like, hey, there are going to be successive waves of this stuff until they actually have a vaccine. The question is, how long do you let the economy suffer for this stuff? And that's just a straight up value proposition of how much. What do you quantify as the value of a human life? Because it's just a trade-off, right?
Yeah.
If the thing is, if you're putting this stuff into a computer model, you just see, a human life is worth X dollars, and we're standing to lose X more dollars than that. That's the right-leaning argument of, well, what's the actual value proposition here?
Well, it's interesting that you bring that up, because in Karmel, I don't know if you saw this. I don't watch Fox News, but I am on Twitter, so I see clips, unfortunately. But Dr. Oz was on Fox News, and he basically talked about that they, reopening schools and reopening the economy, there would really only be a 2 to 3% total mortality in terms of total mortality loss. And I'm curious what your thoughts on that, because a lot of people went crazy, and it was kind of a off-putting comment to make, because you kind of are putting a cost on human life in that sense.
I guess, yeah, it sounds bad with the way when you say it like that. My thing is, what made this different than, because, like, right as of now, and I know people bring this comparison, and a lot of people don't like it, but I'm gonna make the point using what you just said. As of April 5th, there's been 37,000 to 85,000 deaths because of the flu, right? So those people are dead, right?
Right.
Why didn't we not take the time to figure out why they're dying versus we're taking to figure it out now? So I know people will say, well, coronavirus is a new strand. There's a new strand of the flu every year. And I think Dr. Fauci even said this might be a seasonal thing, which is the same as the flu. So when Dr. Oz says, yeah, look, if we just go back to normal because there's going to be a 2 to 3% mortality, it's because we've seen that already. This is not new. We have seasonal diseases that kill 50 to 100,000 people every single year. So as you just mentioned, John, the value prop. So why are we shutting down the whole country now for this? Because we have precedent of things we didn't understand, didn't know. So we're going to lose those people anyway. So we're shutting down the whole economy.
I guess the difference now is it's the whole, there is no immunity for us right now. You know that, again, you'll have, let's say, 37,000 folks die from the flu every year. You can model that out. That's what you can expect. That's what our healthcare system is reliant upon. You have, I don't know, let's say 1 million people a year who die from cancer and heart disease and everything else. That stuff's fine. I mean, it's not fine, right? You're never going to get that thing to zero, because the cost to beat cancer or something, you could probably do it. It's just going to be in the trillions of dollars. It would require such a collective effort. It's the fact that this is cutting through everyone all at once, where if you're not adequately prepared, you're going to not be able to save people from this that you would otherwise be able to save if you had enough ventilators and healthcare people. And the other thing is, with healthcare folks, they're a good chunk of these people who are coming down and dying from that. Whereas they just probably wouldn't do that from the flu. You have someone who's, like the head of cardiology in the ER department, who has 30 years of experience, who just will die in a matter of days from this. Like, that stuff, that's just lost. That's just a lost weight to society. Where you don't really have that with the flu. It's, again, a lot of the stuff when you have a virus that your body can't figure out, the stuff that they end up doing for this stuff, like for ventilators or dialysis machines, it's just taking the heavy load off of you while your body figures it out. But if we don't have those beds ready to take that load off of you while your body figures it out and you build that immunity, you just die. Like, that's just how you're just going to stop breathing and you die. And that's the whole thing of, like, when, like, in Wuhan, assuming we can trust anything coming out of China, which, it's a separate discussion. They initially had something like a 15% mortality rate. Yeah. That's crazy. Whereas outside of there was like 0.4%. So you're right. This, honestly, if this is managed, it could look, and we get a hold of, like, how many percentage there are asymptomatic. If there are tons of people who are asymptomatic and this stuff is really widespread, it could just look like the flu. Yeah. In which case and with that mortality rate, it'll be with us until we have a vaccine or we have effective treatments. But it's just the nature of everyone being exposed to this at once, and it just hits so many people that we just should otherwise be alive, that they're just not alive.
Right. Yeah. If that makes sense. We just weren't prepared for it. But go ahead, Karmel. What were you gonna say?
Yeah. So, like, I guess, yearly we have something like 4 million deaths for all respiratory diseases, just whatever it is, emphysema, pneumonia, corona has been around before this year, so whatever it is, 4 million deaths per year. So has that number skyrocketed this year? It hasn't. So, and the CDC, as of April 4th, marked all pulmonary and respiratory diseases as COVID. So that makes these numbers kind of different. So I'm trying to figure out, what is their plan? If you're changing numbers, whether people are being diagnosed about it or not, they're just changing those numbers to COVID. Now, some people say, well, they want to make sure they're being tested for that. That's what they're looking out for. But then if you're misdiagnosing someone, you're not only skewing the numbers, you're actually affecting the way we treat people. So I don't agree with a blanket way of treating everyone, because our DNA, our eating habits, everything is different. Like, no one's going to react the same. So if we have this blanket vaccine or 4 or 5 different types of them, that doesn't work for everybody. How is that different than what we're doing now with other diseases? So, whether it's my skepticism about, our government and our healthcare system or not, I just look at what is the most effective way of treating it for me. And not to be selfish, but I'm looking at, like, if someone's immune system is already compromised, what are we doing? Why are we changing the entire country? You know what I'm saying? We're changing the entire country's way of life for this 1% to 2% that already have effectively compromised immune systems. Now, that's selfish, and I think that's getting back to what you were saying about Dr. Oz, saying there's a 2 to 3% mortality rate, but that's what we do with every single year. Like, why is this all of a sudden? So my thing is this: why is this all of a sudden new? Where did it come from? If someone says another thing about people eating bats, I'm serious. I'm going to start shooting people. It's the stupidest thing I've ever heard in my life. It didn't come from people eating bats. So where did this come from? What all of a sudden now we don't have an ability to fight this off? Did nature just decide, oh, you know what? I got nothing else to do. I'm going to make up a new strand of coronavirus. Like, that happens every year. Nature always has an effective way of adjusting, whether it's a predator changing to catch prey, the prey changes, vice versa. rainforest, safari, everything changes in nature. So where did this change all of a sudden that we're not now able to deal with it? That's my thing. Like, why are we all of a sudden so shocked and to have this all of a sudden come out and we're not able to deal with it?
Honestly, the simplest answer is that at any given time, there are probably millions of novel viruses that just we don't come in contact with. They don't transmit to humans.
Right.
Every once in a while, you have something that pops up and does this. But you don't want to focus on, hey, what are the total numbers we have so far? Because in an exponential model, it's going to look really small until it doesn't. And when it doesn't, that's like when stuff all gets haywire. But the thing, I guess the issue is, this is all the value proposition, right? That we were talking about with Dr. Oz, or like the 1 or 2% who are immunocompromised. But this can still, this can still mow down otherwise healthy people if you don't have the capacity to deal within the healthcare system. Like, yes, you will have something where, like 2% of people die, or maybe under that, but it will, that metric changes. Like you will end up surviving. You, Karmel, is, let's say just a relatively healthy person who is under the age of 60. Like, you will survive. But that might actually, you might still have to be in the ICU for a while in order to survive, right? And so it gets a lot less. It gets more dicey if your actual recovery period isn't, you're not attended to in a way that we can monitor.
That's another thing I've not really understood. Like, 99% of the people I've heard who on TV or through social media, whatever, have gotten or been diagnosed as having it, are immediately quarantined. Stay home, stay in your room, don't come out.
Right.
So when do they go to the hospital?
Because they're told it depends where you're at, right, in the country or the world. But by and large,
your symptoms are manageable.
Yeah, basically. if you are having trouble like drawing breaths in a way that like you're kind of gasping for air, then it's like, okay, let's go to the hospital, right? That's a small subset of cases, and on it, I guess in the UK, for instance, like going to the actual ICU is a coin flip whether or not you survive or not. So like those are the people who have actually been intubated and they're like being carefully monitored in the ICU. Like once you're in that stage, it's really dicey. But the vast majority of people, you're right, just won't have that. You just won't.
So that's kind of where some of my conspiracy antennas shoot up. Because, like, why do we need thousands of beds in each hospital if 99% of the people who are getting it were telling them to stay home?
Because so many people get it. Right now, the stats are essentially, but the stats are essentially in New York City, 1 in 700 people, or 1 in 1,000 people in New York State have died from this. That's just, when you just multiply something, when you have 12 million people, you need a ton of beds to just see them through. Even though, like, again, 2% of people may die, other people need those beds to survive. Otherwise, that 2% turns into 10%.
And then it keeps growing from there. Does that make sense?
Yeah, but that number is still very small. That's not the hundreds of thousands of beds we need. Per some of these people we're talking about, they're saying we need these astronomical numbers of resources and supplies. And, like, I get it if you've been just inundated with people, but I haven't seen that. So I'm trying to understand.
Yeah, I guess
telling people to stay home. Why do you need 10,000 beds at this hospital? Because my mom actually lives in an area of Downey that's a lot of medical centers around here. She actually lives right behind the hospital, Presbyterian Intercommunity. There's not many people here. And this is actually this area has a lot of old folks' homes, which my mom lives in. So I'm like, where are all these people going? I haven't seen this inundation of people at these hospitals. I get when people are sick, you may need a few beds, but 4 billion masks and 4 billion ventilators, these numbers are just, for me, that's why I get upset, because I feel like a lot of this is fear-mongering and getting people like hyped up about something. I get we need to take care of people. I get we need to treat this differently than something else because it's a little different. But the overreaction to me just makes me think, what is this really about? Because this can't be, the numbers aren't bearing that out in terms of what the numbers you're saying you need.
I mean, I get your thoughts about like mass hysteria. That happens in like almost every situation. If we can be honest, that's just like how human nature is. We tend to overreact about things, but you can't compare a city of Downey to like the city of New York. You know, like I'm always of the mindset it's better to be over prepared and overly cautious than to not be prepared at all and have this be 10 times worse than it is at this point, you know?
I mean, if you have,
I completely agree that. So I'm saying is, why do they have to make it news? Why do they need to go on the news and tell people what they need? They can do that without us knowing it. Why do I need to know you need all? Because when you keep telling people these things, people tend to react because you're saying, "Oh my God, we're inundated," and then.
But how are they reacting? I guess.
Who's they?
People. You said when
That
you
is
tell
the
people
question.
that, when you tell people that, they react.
Everyone. I mean, for me, I've been on Facebook and Instagram for this entire time because it's just absolutely asinine the way people are acting and talking. And I can see you go on the street and see it. People are acting very like, don't want to touch you, don't want to talk to you, don't look at you. Like, I mean, that's not how you get this thing, so relax. But like a lot of that has become because of what we're seeing on the media and the news. Like, and even speaking of New York, CBS News was outed for having posted a video of a hospital that wasn't in New York. It was in Italy. When they were showing people in Italy, and it was really not, I mean, it wasn't New York, it was Italy. I'm like, how did that happen? That's not a mistake.
It was irresponsible of them, obviously. And I'm not saying that media isn't without fault. I mean, we know media messes up. We know media does tend to make things a little hyperbolic sometimes. But we wouldn't know anything that was going on if it weren't for the media. But I get your point. It's like, well, we don't need to make it.
It's right. It's, I mean, they're two competing. When we say media, I think we're by and large thinking of like a CNN or something, right?
Yeah.
I think that the tenet of, if you are in a position where people listen to what you're saying, whether that you are the government or you're media or something, this isn't my quote, is someone from the Obama administration. Who essentially, I think it was Volcker. He said, your greatest asset in a time of crisis is your credibility. So that's where, I mean, whether it's coming from, again, the government saying things that just aren't true, or media saying, hey, look at this New York hospital, it's so dire and everything, it's in Italy. That's the stuff that just undermines everything. And I totally get that kind of just, well, this just makes me not trust you, right? I guess the flip side of things is like when there are fear mongering. The issue is like when you build out all of these, you know, hey, we need this bed, we need all these beds, we need all this supply, we need all this protective equipment and everything. That is for the worst case scenario, right? If 2% of the entire country dies from this, that's 7 million people. World War I, we lost of this country 500,000 people. That size and scale of that is something we have not seen in our lifetimes. And if that is blown out around the world, and that's bigger than other pandemics. So that stuff is terrible. But the way you don't need all those beds is if people stay home, right? Those models are updated all the time, and you see the actual effects of people staying at home. In which case you don't need those beds. And it's like, well, did we waste all this money and resources for that stuff? Like, I don't know. Like, because it could have been bad, but it's not as bad. So what I'm saying is that fear mongering, it sucks in the sense of you're distrusting things, but if it actually gets people to stay home, I don't know.
And that's the thing. So I don't know if you've seen a few states, and specifically Texas, I think Michigan. I'm trying to think. There's some other states. They're protesting about these stay-at-home orders. And one, like John said, if they had stayed home, we wouldn't need all of these beds because people are asymptomatic and they are exposing each other to this virus. But I don't know if you saw this quote that I posted, because I know you've been off of social media, but the White House economic advisor, Stephen Moore, he was talking about these protesters. They're literally protesting in front of hospitals, protesting in front of government buildings. He said that they were modern-day Rosa Parks because they were protesting against injustice and loss of liberties.
I'm not going to totally disagree with that, because
really?
I don't necessarily agree staying home is the best method. Now, so when it comes to credibility, Dr. Shiva Ayurveda, I think I might be pronouncing his name wrong. He's a politician in Massachusetts. He's also a biologist and scientist from MIT, PhD, all that good stuff. He has a completely opposite take on it. He's been a opponent of some of the things Dr. Fauci has said, and completely disagrees with his way of handling this. And he says, well, a lot of it has to do with a political system and big pharma, because he thinks the best way to beat it is through immunity, and immunity through community, being around other people. So that's what we've done our whole lives: get in the dirt, play sun. And the sun is one of the biggest things the CDC, Johns Hopkins has said from the get-go is the sun neutralizes the disease. But now we're all told to stay in the house. So that, to me, for a person who naturally is in the sun on a regular basis, now my immune system is being compromised because I'm not allowed to be around people. I'll be honest. I can walk in the backyard, do that. But I can't work out like I used to. I can't do the things I'm normally used to doing. That's helped my immune system. So I don't necessarily agree with that. Now, how these people are going on protesting against it, I don't know if that's the best way to get what you want, but I think a lot of people are getting to the point like, look, I don't want to be in the house with 1 to 2% of this population. Why not do it the opposite? If you have a compromised immune system on record, if you have a medical case that's already open regarding your immune system, why aren't you the people staying home? Because people are walking around who are asymptomatic, and we have it. We're not hurting each other because we're all asymptomatic. It's the people who walk out who are compromised. It is the older people. It is the people who already have emphysema and pneumonia, whatever, or maybe have lung cancer, things that are already putting you in that situation, or asthma, whatever it might be. Why are we not having that 2 to 3% stay at home? Why are we flipping it? So I get what people are getting, especially Texas. You can't tell Texas anything. So I kind of understand it. So the thing is, there's people who have credibility who are against these methods, but they're not also in a place to speak on it like a Dr. Fauci or some others.
But you don't think it's irresponsible for these people to be going out and protesting and still going to the beaches and still having public gatherings when they don't really know where this virus lies, or if they have it, or if they have symptoms or anything like that?
If the people who have compromised immune systems are out, how are they not irresponsible?
But you don't think that's like just honestly like discrimination. If you already have this, stay home. But if you're completely healthy,
no, it's not discrimination. You can come outside if you want, but you might get sick and die.
I mean, but
that's on you.
So the staying at home is to protect those people. I mean, they failed. This is what I will say. They did fail by saying that this virus doesn't affect basically a specific age group, younger people that are healthy. And then you find out a lot of younger people that are healthy are getting it, and some people have even died from it. So to me, there's really no guidelines on who this virus will attack, who it will affect, or how bodies will react to it. Hence why everybody just keep your ass at home.
But see, to me, that's with any disease. Young people can get a lot of things, and 90% of them are fine afterwards. The small percentage that do have an issue typically already have underlying issues. Italy, and China, and all these other countries that kind of have been through the whole up and down curve, it was like 98.7% of the people who died from it had 1 to 3 underlying issues. It's a very, very extremely rare chance where someone has nothing, gets the disease, and dies. It's such a minuscule number. Like the people who are like, I don't have these issues. Like, why am I staying home? Like I was at Polly's the other day. My mom wanted me to get pies at Polly's for Easter. I go in and there's 6 feet a space between everybody. Everyone's got their mask on, and a lady walks in and she's upset because she has issues and she thinks we're 5 feet apart. Like we're too close. I'm like, well, why are you here? You don't have to come to Polly's Pies. You don't have to go outside. You don't have to do anything. You can't come in here and get mad at us because we're all trying to get pies and we don't have your issue. But the way she got mad, she's making an open complaint about it. I'm like, that's like someone who wants tacos from In-N-Out. Like, they don't make tacos. Like, go to Taco Bell. Like, I don't understand why people have this issue where we all need to, like, change because you have an issue. I get being,
compassionate
and compassionate. No, I get all that.
Yeah.
But we're shutting down. I mean, our economy is in a recession, almost of a depression now because of 0.5% of the people. I mean, it doesn't make sense.
It does come down to how much you care about your neighbor. And me being the person I am, I think if me staying home, being the healthy person that I am, can save other people's lives, I'm willing to do it. I'm a homebody anyway, so I haven't really been that affected by this. I know people that are going through depression by being at home and being quarantined. But at the end of the day, if it does save people's lives, I think it's a very small sacrifice to make.
But there's ways that we can also save people's lives that we're not talking about.
Well, yeah.
No one's talking about building up people's immune system. It's funny, there's people over here wearing masks going to Randy's Donuts. What? You're wearing a mask, but you're going to eat food that's going to give you diabetes and heart failure. I don't get that. We're not.
Maybe that's all that they can afford. And also, have you had a Randy's donut?
Hey, I like me a donut. I ain't gonna lie. But at the end of the day, that's compromising your immune system.
Right.
People wearing a mask and then lifting up to take a smoke. Like the stuff doesn't make sense. There's other things we should be. I do care about my neighbor. So for me, I'm going to give them every resource to help them get better.
Right.
We don't get better through avoidance. That's never ever worked. I don't. That's in every scenario we looked at. Avoidance does not beat immunity. Natural immunity is always the best. Natural foods, natural causes, natural ways of beating diseases is always going to trump not being around something or taking synthetics or whatever to build immunity. You don't know that's going to work. Because people get flu shots every year, and it's like, oh, it didn't work. I still got the flu. Because you can just build your immune system naturally. It's not about taking a shot. Like, build your immune system naturally. I can't remember the last time I've ever been sick. Because I don't even have that mentality. And that's another thing is now people are starting to have mental issues from being in the house too long. So now we're causing more issues because we're saying we need to take care of this small percentage of people. And I understand being compassionate, but we're affecting a lot more people now with something that we could deal with a whole different way.
And that is a deeper issue, I think, also talking about the mental health aspect of this. I do see it affecting a lot of people, and I think, like I brought it up, and you just brought it up now, I do think that's something that we should talk about probably in another podcast. But John, you were going to say something.
Yeah, I mean, I guess it's two main things that I think we hit on earlier. One is the absolute crush of our healthcare system dealing with these things all at once, in which case you have the 0.5% death rate turn into something that's much larger. Which is a huge drain on society when you can't replace those jobs and those people. It's one thing to be depressed because you're home for a couple of weeks. It's another thing to be depressed because your mom died. And then the second thing was focusing on only the death rate, right? 0.5% of people may die from this, but there are other people who, a lot of times when someone comes down with a really bad virus, you might have some secondary infection that will hobble you for the rest of your life. If you're unfortunate enough to get something like ARDS from this, you might not be able to walk up a full flight of stairs again, without stopping to catch your breath. So there are some of these things that just like you're going to bounce back and be great. Other times you're not. It's just how these things end up happening. That's a hidden cost if you're only focusing on the death of this stuff. Mm-hmm. And a lot of stuff is, again, like you're building up your immunity. Yeah, you can do all of these different things to hopefully boost your immune system. But in the meantime, while your part of that thing is building up your immune system is that hospital bed, right? It's buying your body, your immune system time to figure out that virus. And then the last bit about flu shots. Some of they're effective. I don't know, 30% of the time, something like that. 40. I don't know what, or even less. But there's something, because again, a vaccine for this stuff, a flu shot for this stuff. It's just essentially a set of code to your immune system. It's a map that's like, hey, this is how you figure this stuff out. So, and because flu strains just mutate every year, you might have something that's like a partial immunity to something, where it's like, hey, your body isn't starting from scratch to fight off a flu. It's working on something that you got a while back.
Yeah, and I understand how all that works. I guess it's like we're picking different percentages of side effects or different percentages of possible death. It's like it's one or the other, Like even with the flu shot, I know it's a small possibility that people get Guillain-Barré syndrome, which they can go completely paralyzed. Like my stepdad, she knows of an older gentleman he was in, I guess, service with, who got that from getting a flu shot. So it's like, which of the chances are we willing to take? Like if it's going to be this one or that one, So there's all these possibilities out there that could hurt people, kill people, or whatever. Who's getting to say which one is right for me? That's why I think a lot of these states and people are rising up, because they want to be able to decide, here's what I want for me. I understand this possibility. I get that possibility. I want to pick that one. But now we're getting to a point where I feel like another civil liberty or civil rights can be taken from us because the way people are reacting. Whether it's big pharma, whether it's political agenda, whatever it might be, someone's going to decide, okay, now you need a vaccine before you can get a passport. You need a vaccine before you can come back to work. You need a vaccine before you go to school. What if I don't want that? And I don't have that opportunity to make that decision or choice because of this knee-jerk reaction to the possibility of these happening.
Yeah, I mean, that's what powers do we give the state to compel us to do things? It's like if you get drafted, if you get conscripted into a war you don't believe in, I don't have to do that. That's not, no, actually, you do have to do that, or you have to, spend time in prison. Some people don't want to file taxes and pay money into government services that they aren't using. That's fine, but like the IRS will garnish your wages. There are certain things that you just, or you know what, I don't like, if I didn't like someone in a protected category, I didn't like gay people or black people or something like that. Like I actually can't discriminate against them because it's a protected category. But I want to do that. It's like, well, okay, that's fine if you want to do that. But like there are certain laws out there that you just can't do it.
Right.
This is how that's the issue of being born and being issued a social security number and being a citizen of a certain country.
Well, we have a lot more to talk about when it comes to COVID-19 because this isn't going away anytime soon. But we're glad that Karmel, you were able to call in and talk since we can't be face to face. And we're glad you guys are listening. But for now, please do stay home and be safe. And we will talk to you guys next week.
Y'all be good.
Bye. Don't forget to follow us on Facebook and Instagram at We Need to Talk the Podcast and Twitter at _We Need to Talk _.